Hey, welcome back. Today, we're talking about something that's going to affect millions of Americans, budget cuts, and what they could mean for programs like Medicaid and Medicare. There's been a lot of debate about government spending, tax cuts, and the national debt, but what does it all mean for everyday people? Well, if you're someone you know relies on Medicaid or Medicare for healthcare, this is something you'll want to pay attention to. The House recently passed a budget plan that includes $2 trillion in spending cuts over the next decade. And while they haven't spelled out exactly where all the cuts will come from, one thing is clear. Both Medicaid and Medicare are in the conversation. The plan directs the Energy and Commerce Committee to find $880 billion in cuts. And that's raising some serious concerns. Because when you're talking about cuts that big, it's hard to imagine a scenario where coverage isn't affected in some way. And that's where things get complicated. On one hand, some argue that Medicaid and Medicare spending has grown too much and that reform is necessary to prevent waste. On the other, millions of low-income Americans, seniors, and people with disabilities depend on these programs for health care. If benefits are cut or eligibility requirements become stricter, it could leave a lot of people without access to necessary medical care. So what exactly are Medicaid and Medicare, and why are they always at the center of budget discussions? Well, Medicaid is a joint federal and state program that provides healthcare coverage to over 72 million Americans. It helps people with low incomes, seniors in nursing homes, and those with disabilities afford medical care. Unlike Medicare, which primarily covers people over 65, Medicaid serves a much broader range of individuals, many of whom have no other way to pay for healthcare. Medicare, on the other hand, is a federally funded program that provides health insurance for people aged 65 and older, as well as some younger individuals with disabilities. Unlike Medicaid, Medicare is not based on income. It's something that most people have paid into through payroll taxes over their working years. That's why when cuts to Medicare are discussed, it hits a nerve for a lot of Americans. They've contributed to the program for decades and expect to receive the benefits they were promised. Now, politicians will often say that they're not cutting these programs themselves, just reducing costs or targeting inefficiencies. But let's be real, when you're talking about nearly $1 trillion in cuts, that's not just about administrative tweaks. That's going to impact real people. It could mean fewer covered services, higher out-of-pocket costs, or stricter eligibility requirements. And here's where it gets even more interesting. President Trump has repeatedly promised that he wouldn't touch Medicare or Medicaid. He's said on multiple occasions that cuts wouldn't be necessary. But at the same time, the budget his party just passed is calling for massive spending reductions. So something's got to give. Now, you might be wondering, how does this tie into tax cuts? That's the other major part of this plan. The House budget includes about $4.5 trillion in tax cuts, largely focused on extending the 2017 tax cuts that are set to expire. That means keeping corporate tax rates lower, eliminating taxes on tips, and reducing or removing taxes on Social Security benefits and overtime pay. And while tax cuts can be great for economic growth, they also mean less revenue for the government, which has to be made up somewhere else. That's why spending cuts, especially to programs like Medicare and Medicaid, are becoming such a hot topic. If you cut taxes without reducing spending, the national debt grows. But if you cut spending, you have to decide where those cuts come from. And right now, healthcare programs are a primary target. So then, what does this mean for you? If you're currently on Medicaid or Medicare, or know someone who is, it's important to stay informed. Changes to eligibility, benefits, or funding levels could impact access to care, and the details of those changes will depend on how Congress moves forward. And even if you don't rely on these programs, these budget decisions affect the entire healthcare system. Hospitals, doctors, and insurers all adjust their costs based on federal healthcare funding, which can lead to ripple effects on healthcare pricing across the board. Besides that, there's also the bigger picture, how the government balances its budget and what it prioritizes. Right now, the focus seems to be on tax cuts, defense spending, and border security, with safety net programs like Medicaid and Medicare facing reductions. Whether you agree or disagree with these priorities, it's a conversation worth paying attention to, because at the end of the day, Government budgets reflect policy choices, and those choices have real-world consequences. And next, we'll be watching closely to see how the Senate responds. The House has passed its plan, but the Senate still needs to come up with its own version, and there are already divisions within the Republican Party about how to proceed. Some senators want to push tax cuts first, while others are more focused on defense spending. That means the final version of this budget could still change, but Medicaid and Medicare cuts are likely to remain a central part of the discussion. So what can you do? Stay informed. Budget plans like this can seem complicated, but at their core, they're about priorities, where the government chooses to spend money and where it chooses to cut. Understanding how those decisions impact you is crucial. And finally, keep an eye on the numbers. A lot of these discussions get framed in broad terms: tax cuts, spending reductions, deficit control. But the details matter. Who benefits, who pays the price, and what does it mean for the country as a whole? That's what really determines whether a budget is working for everyone or just a select few. So, let me know what you think. Do you agree with these cuts? Do you think Medicare and Medicaid should be protected? Or are you more focused on tax relief? Drop a comment below and let's talk about it. And if you found this helpful, don't forget to like and subscribe so you don't miss out on more updates like this. Take care, and I'll see you next time.